What is meant by cold chain? A cold chain is a system of storage and transportation of vaccine from the manufacturer site to vaccine site at low temperature, that is 2 to 8 degrees Celsius, called cold chain. Cold chain is defined as is a system of storage and transport of vaccines from manufacturer site to vaccine site at low temperature 2 to 8 degrees Celsius, called cold chain. And here the next equipments of cold chain. So it includes WIF, WIC, walk-in freeze, walk-in cooler, and deep freezer, ice-lined refrigerator, vaccine carriers, day carriers. And the temperature maintained for this walk-in freezer is 15 degrees Celsius to 25 degrees Celsius. And in walk-in cooler, the temperature they maintained is 2 to 8 degrees Celsius. And for deep freezer, maintained temperature is 15 degrees Celsius to 25 degrees Celsius. And for ice-lined refrigerator, maintained temperature is 2 degrees Celsius to 8 degrees Celsius. So let us discuss one by one. Here, see here, walk-in freeze already we have discussed. In walk-in freeze, the maintained temperature is 15 degrees Celsius to 25 degrees Celsius, and it installed at national level, state, and regional. The next one, WIC, walk-in cooler. It installed and the temperature is 2 degrees to 8 degrees Celsius, and usually it installed at state level, regional, and district. And the vaccine transports vaccines transport through this process is BCG, DPT, hepatitis B, pentavalent, and inactivated polio vaccine, TT. The next one, deep freezer. The temperature maintained for this equipment is 15 to 25 degrees Celsius, and here it is used to store oral polio vaccine for 3 months at district level, and it is also used for freezing ice packs. The next one, Iceland refrigerator. The temperature maintained for this Iceland refrigerator is 2 degrees Celsius to 8 degrees Celsius, and it stores the vaccines at district and sub-center. The next one, vaccine carrier. Vaccine carriers carries almost 16 to 20 vials with 4 fully frozen ice packs, and day carriers it carries 6 to 8 vials of vaccines with the 2 fully frozen ice packs. Then here you can see polio vaccine is a heat sensitive vaccine. It should be stored at minus 20 degrees Celsius, and measles and polio both are heat sensitive, should be keep in freeze compartment. Then freezing sensitive vaccines are TT, DPT, BCG, HPV, HPV, IPV, hip, rotavirus, and these vaccines should be kept in refrigerated cold compartment. TT, diphtheria, pertussis tetanus, BCG, and human papilloma virus, hepatitis B virus, and inactivated polio virus, hip, rotavirus. So these vaccines are called freezing sensitive vaccines, should be kept in the refrigerator cold part. And next one, shake test. The test is used to check whether freezer sensitive vaccine damaged or not. Is a test used to check whether freezer sensitive vaccine damaged or not. The next one, what is meant by reverse cold chain? Is a system of storing and transporting sample at recommended temperature for point of collection to laboratory is called reverse cold chain. From manufacturer, the transport of vaccines from manufacturer site to vaccine site called cold chain, and from point of collection, sample from point of collection to lab is called reverse cold chain. So this is about vaccine and this is about samples. The transport of vaccines from manufacturer site to vaccine site is called cold chain, and the sample from point of collection to lab called reverse cold chain. So example here you see, uh, when after collection of a stool sample from the acute flaccid paralysis patient, it should be sealed in container. After that, it should be stored in refrigerator or packed between frozen ice bag with the temperature 4 to 8 degrees Celsius, then shipped lab immediately. So this is about reverse cold chain and shake test and cold chain and equipments of cold chain.